Members, how are all of you?
Good morning.
And then let me share this once this starts live.
Kate, I did want to let you know that
Carl,
if joins, Vicki and I can only stay for an hour today. We let Abigail know, but I didn't know if it got to you and Brad.
Not a problem.
Kelly, thank you so much. Good to know.
Okay, well, can everyone see the slides? Excellent.
Yep, look good.
Okay, well, welcome everyone to our last scheduled Transparency Board meeting. Just want to say thanks everyone for continuing to participate, and hope you're able to stay cool as the temperatures start heating up this week if you're in Connecticut. So briefly, we're just going to go over our agenda. Welcome, review of last meeting. We're going to talk about ongoing Transparency Board over our transparency oversight, do our subgroup kind of report outs, review a draft report, and then next steps. I think today will likely end early, but we obviously have the full time if we have further things for discussion. But I look forward to folks' feedback, and we'll kind of just jump right in. So, and I might toss it to Kate initially to do a brief recap, if that's okay, Kate, from our last meeting, and we'll just get into it.
Sure. Thanks so much, Brad, and good morning, everyone. We're really indebted to you for the continuing investment of time and insight in this great and important work. So as we well know, the last meeting of the board featured report outs from our standing work groups. We did essentially ratify the principles that were proposed by the principles work group. We had modified those just to emphasize in every kind of iteration of the principles, the primacy of the focus on equity. So I think that we had a good sense of the group that those were an important litmus test for the decisions that we make around selection of data points, the way in which we visualize, the context setting that we do, and also the analyses that we perform ongoing of the data to avoid unintended consequences and bias for the Medicaid membership. And I really appreciate all the thought and intention that went into that discussion. I think it really gives us a great frame and a set of values to which to refer ongoing. We also had a report out from the quality work group, really explicating in much greater detail all of the plans around the subparts of the focus areas, starting to enumerate particular measure priorities, and also so usefully starting to stage out the nuts and bolts of the visualization of the data. Really indebted to that group and also to Susan Smith for really starting to think about the mechanics of how we roll out the dashboard and how we iterate to future state there with respect to opportunities for drill down and expansion of the data points that are featured. Also, there was a great discussion of the priorities of the finance measures group. We are in this amazingly strong position there because of Deputy Commissioner Mike Gilbert's longstanding work, the sustainability framework that is developed for Husky Health, which touches on important indicators related to our overall cost trends, relationship to the state budget, across both in our own right and then comparatively across states, our PMPM trend, and other features that start to elaborate on the relationship of our spending to priorities and categories of service that reflect policy principles, policy priorities. So I feel like we're in a very good position in terms of having raised up this corpus of work on behalf of the body. Today, I think it will just be an opportunity for all the work groups to continue to provide nuance there. And Brad, I will turn it back to you, to signal next steps.
Sorry, I'm still muted. Just a quick jump to where we are. We're just hitting end of June, July. So again, last meeting, we'll finalize our recommendations. And we're pretty much at the end of this initial phase. And so I know there's been a lot of questions coming up about discussions of ongoing transparency oversight, which is really obviously, I think, important. And so did want to at least cue that we had had a discussion with Commissioner Gifford, and she's supportive of ongoing efforts of this board to continue to meet to help with ongoing transparency work that we have. As long as people are interested in that, we would, I think, welcome that on a likely quarterly basis to help us. And obviously some of this will need to get worked out, but in general, help us make sure that this work continues and that there's an appropriate, oversight of the work, and also feedback to us, because as we know, this, while we're producing a report, this will be an ongoing process and things will need to change over time. And so getting I think this board's expertise, which I know Kate, Susan, and I have been extremely appreciative of, will be really important on an ongoing basis. And Kate, let me turn it over to you, see if there's anything else you want to say about that or comment on wise.
Yeah, Brad, I think you put that incredibly well. Commissioner Gifford strongly endorses continuation. She would find it extremely valuable to continue to have that advice and comment. And I think, especially in the principles and the quality measures groups, we've mapped out further stages of this work beyond the initial, production of the dashboard. That really commend continuing advice from this group around, like I started to say, measure selection, avoidance of unintended consequences, the overarching emphasis on equity. And so today, we really did just want to ask the group for a sense of the group. Do you generally endorse us? We'd love to hear from folks who are inspired to say something. We hope that we have a good sense of the group that has been strong positive. We have definite specific notice from many members of the group, but I'd just like to open it up for a few minutes just to ask folks to weigh in on this. And also to say with great gratitude that if folks who may have originally understood this to be more durationally limited, have obligations that prevent them from serving ongoing. We have complete respect for that, and we'll just thank you so much for the investment of time that you've given up to the point of producing the report, the initial report of recommendations. And then the commissioner would look to recruit additional folks ongoing. That would be the plan. But like I said, Brad and I would be very interested to hear from members of the group, just to hear your overall impressions of continuing.
Bonnie, go ahead, please.
I'm very excited for the opportunity to continue, and know that Liberation Programs and John Hamilton also give their full support for my time on this. And I think for many of us, we feel heard about the opportunity to continue together. It's been, I think, a really positive experience with a really impressive incorporation of all of the expertise and input. So looking forward very much to continuing.
Thanks, Bonnie.
I can speak if.
Go ahead, Grace.
Yeah, so I just ditto what Bonnie said. I think it's been an incredibly productive process, and I would look forward also to continuing to provide any support I can to ongoing transparency and oversight.
Thank you. The other thing, it might, if you guys are interested or want to share any thoughts on what even things could look like, we could always include some of those details if you have particular thoughts. Karen, please.
Oh, sorry, I feel like you read my mind. That's what I was just thinking about. I would be happy to continue. I think that the dialogue has been really interesting for me outside of the work of the board. I would like to see some of the requests that we made in the principals group kind of answered or fleshed out as we move forward. So what is the process for developing new metrics, for example? And I do think that ongoing discussion of how we present data, particularly from an equity perspective, could be helpful for all of us, right? I don't always know the limitations of the data, but I do know something about how it can be interpreted or misinterpreted as it's presented. So anyway, those are my thoughts.
Thank you, Karen. Other thoughts, including ideas, kind of as Karen was just saying about how do we execute on some of these things, on some of this, including the principals work, is that incorporated into the continued oversight from this board, or what will evolve into from this board? Any additional thoughts, and maybe, oh, go ahead, Sandy.
I agree. I think that having ongoing transparency oversight is really key, because I see this as sort of the first step, and in an evolution of really coming up with something that is viable and able to be practical and actually work on a more long-term basis, and recognizing that in medicine things change, and quality measures, especially that I'm interested in pediatrics, we have different, over time we recognize that some things that we thought were important maybe are not quite so, and others are something that we kind of need to look at that maybe we didn't think of in the first place. So I agree. I think that that's really important.
Susanna? Thank you, Sandy. You're still on mute.
Sorry about that. It's a double mute. I wanted to echo some of what Sandy said, and really sort of 3 specific things that I think may be useful to you all that I'd be happy to see this board continue to participate in is, sort of measure curation, right? Both thinking about whether there's measures that aren't serving a purpose as much, but really focusing on bringing in measures we may not be able to have in at the beginning that become viable. So making sure that the set of measures stays responsive to the principles. But then to the point that Karen made, thinking also about sort of whether the way the information is portrayed is useful, continuing to evolve that. And then the third is that my hope is that our ability to benchmark will continue to evolve, and that it's worth keeping an eye on the opportunities for the benchmarking, right? So it feels to me like Connecticut's about to do something that steps ahead of a lot of other states, but I would hope that over the next year, we'll find that other states have gotten creative and there's new opportunities for benchmarking. So I would think about both the set of measures, the way the information is portrayed, and the benchmarking as all being areas of sort of active evolution that hopefully the board could help you with.
Susanna, I just want to say, reflecting back, I really appreciate that point. I know that the Center for Medicaid and CHIP Services, in its dashboard work, is trying to be very intentional in that respect. Also, they've always described that dashboard, the scorecard rather, the national scorecard comparing Medicaid and CHIP programs as planfully iterative, and I think that's one means of engagement that I think will be important to us. Obviously, we can be self-actualizing in some of these respects also, but very well said.
I just wanted to say, I think along with Karen and Suzanne, what you're, and Sandy and Bonnie, is maybe one of the first steps we could do is create some sort of charter or something for this group to help kind of be very clear about kind of the role of the ongoing oversight. And Karen, I think kind of highlighting what you were saying, make sure to have this kind of agreed upon by the group of all the things that the oversight committee or advisory committee or board, or whatever we're going to call it, should be doing, and all those functions, including things that Susanna, you just highlighted, and how to incorporate principles of data use and measure creation and measure portrayal and benchmarking, et cetera. And so what are the functions of this group moving forward moving out of kind of this initial design phase and now maybe more to a oversight, implementation, and continued evolution of this process. I don't know if that sounds right. That might be a good proposal that I might suggest we, as like a next step, is to create a charter or something like along those lines to elaborate on what our role and responsibilities or your role and responsibilities will be alongside, to make sure that we're capturing all the things that we think are necessary. Again, for those who are able and willing to continue to be involved. And I think as Kate said, we understand like that's may not have been the initial ask for this group. So we understand it for those who are not able to understandably or to continue to be involved. But would that be a reasonable step? I'd love to kind of hear if that sounds like a good kind of process step for us, is to kind of, as a group, create a charter, not today, I think, but in the future, kind of come back together and develop that, obviously with DSS input for kind of in a collaborative process.
Right, I think that makes a lot of sense, and I'm happy to participate in. So, be great.
Thank you. And I've been seeing a lot of your face on buses this weekend.
Sorry about that. We all crosses to bear, pal. That's just the way it is.
I was enjoying it. It was great. I was like, I know that guy. My daughter was super excited. Just wanted to put that out there. So, Ben, let me throw it to you.
Great, thanks, Brad. Yeah, I think that's a great idea for a next step. I'd be very happy to continue participating as a representative from the FQHC world. I think one component of the next steps that I just like to underline is if we could incorporate a way of really better understanding who's going to be utilizing this dashboard. Not that we need to police that in any way, but I think having a sense of what kind of sectors, where in the state, what kinds of communities are using the platform that we're going to be generating, just so that we can make sure that it's getting into the hands of the broadest swath of people and communities and sectors that's possible.
Thank you, Ben. Anne?
Yeah, thank you very much. I agree with everything that's been said. I think the charter is a great idea to help guide where we're going to go in the future and how to help. But I also agree, how are we going to visualize the data? Who's going to use the data? How are they going to use it? How does the consumer use it? Maybe it's even some listening sessions around the ease of use. It can be overwhelming as a consumer to go out and to look at all the data. And I know we've talked about that, but I think that we have a great opportunity to be, cutting edge, leading edge on this, and be able to show others how we engage with our consumers and everyone else who would need to use the data, and make sure we have multiple levels and ease of the use of the data. So.
Thank you, Anne.
Thank you. And I will continue also. I'm very excited about this work.
Great. No one has to, we appreciate the excitement. You don't have to commit now. We won't make you, put your mark on the Zoom meeting, so to speak, but we'll make sure to follow up after this at some point, so people have an opportunity to think about it and decide what makes sense on their end. But we're excited for all those who have spoken up and are willing to participate. So thank you. Any other thoughts? I mean, I think we have a good, again, I think really the next step that we'll incorporate probably into the final report will be ongoing oversight from a basically board like this, with the need to create a charter that will elaborate on goals of the group in terms of the oversight. That's kind of poorly summarized in my words, but I think that'll probably be what to include there. But Mag, please let me turn it to you.
Sure, I just wanted to, I think the charter is a good idea because it also defines who we are and who we're advising. How I think we were originally formed by an executive order. I'm not sure, but so sort of kind of makes it permanent. What's our relationship to MAPOC? Do you know what I mean? So I think a charter is a really good idea because it sort of gets a good understanding of who we are and moving forward and what our role is.
Thank you, Mag. Any other thoughts on this before we move along? All right, so kind of moving along, we're just doing a brief discussion. I've kind of outlined we could do up to 20 minutes. Really, the principals group didn't need to reconvene, so we don't need to touch on that. Just really the quality measures and finance. And I unfortunately didn't get this complete till pretty late last night, so I didn't get a chance to ask our normal team to kind of present. So I'm happy to highlight some of the efforts that have come out of this myself, though I normally would ask that other members of these committees would do that. So the quality measures detail, this is slightly modified and pulled in a few other things as we've been talking about. So just want to highlight these different phases, which tried to pull together from our different work groups, including the principals, the finance, and also which I know is not really work, but the visualization components that Susan has really helped with, so that we can people can understand kind of where we're headed as all together. So really phase one is high level currently accessible data, including metadata. So this got really pulled into the visualization component. And then phase two starts pulling in high level external data to TDS and capturing new internal data. Phase three, interactive and integrative. So really being able to drill down even further that we may not be able to do. And these really should be parallel and ongoing phases rather than one to basically sequential. And then ongoing evaluation, which I think based on our conversation today, this might be one of the roles of the Transparency Board ongoing, but ongoing review of new measures being captured for integration, and then development, implementation of new measures. So again, I think some of this may fall within the scope of this ongoing engagement. Before I go any further, any comments on this specifically? And if you do end up having a comment, we can come back to it. Again, this will be incorporated into the final draft report, which I'll be requesting feedback from everybody on. So you'll have another chance to review this. If you don't have any thoughts now, you still will have opportunities to make comments before it becomes finalized. Karen, please weigh in.
This may be later in the slides, but I was just curious if there's a timeline associated with this. I understand that, they're concurrent, but is there a timeline for the entire process?
That's a good question. I don't think there's necessarily one, and I think we'll keep that question in mind because we're going to come back to an overarching slide on all the phases, and maybe we can discuss it because I think that's an important thing that you raise. And we may want to try and align our phases for each of these subgroups together of all the work. But can you bring that back up if that's okay, Karen, when we get to that other overarching slide? Thank you. So. And before I move on, sorry, any other comments or thoughts? Okay, so for now, again, you'll have opportunity to comment further. So these are the same categories we've had before, just slightly put into a slightly more visually, well, maybe I think more visually appealing way. And then this is a new slide of the quality measures, of really an overview, because as we'll see later, the actual measures were becoming, which is great. We have a lot to display and recommend, but it's becoming a little unruly for like a summary slide, if that makes sense. So really trying to say this is the goal of each one of these. And maybe just talking out loud as I'm reviewing this, we might even be able to get rid of this and just have this slide. Basically kind of saying that our indicators, this top one of population health, well-being, and primary care, of our population well-being and primary prevention. The clinical quality is really focused on Medicaid and CHIP individuals, disease incidence, prevalence, and prevention, social determinants of health, individuals' access and addressing of the social determinants of health, enrollment access to providers, and enrollment in the programs, special populations, special groups and populations, health and well-being, things like MFP, CHATS, waivers, and managing costs, ability to manage costs as it pertains to quality. One thing I think that might be helpful in light of some of the work between both the quality and finance group is whether we should call this out under the quality measures group, or, because there is some blending, and we'll get to this in a minute, between the finance subcommittee and the quality subcommittee. So I would like us to return to this at some point, so we can kind of agree upon, like, is there too much overlap between this work in the finance subcommittee, or is this appropriate to call out in each venue? Because I think we probably agree getting to value in healthcare requires quality measures and financial oversight and cost oversight. So this gets really into the details. So really a big thank you to a lot of the quality committee members who also sent a really helpful summary of some data and like what we should be including. I think I included everything that was recommended here. One of the things that I need to do and we need to do internally is really identify what we easily have accessible. I will be returning to this in short order before I send it out to all of you to kind of highlight, like, what do we have, what data do we have internally at DSS accessible right now that we could easily turn on in terms of presentations versus what are things that we aren't collecting or external to DSS or might be, or we don't have easy access to in terms of the data. Not that we shouldn't be displaying it, but just in terms of process steps, probably very helpful. So I'll give everyone, take a moment and take, again, phase one really is things that we have access to or should have access to. Phase two are things that are external or new measures to DSS or things that we need to modify to actually collect. So the goal would be for phase one, things that we currently could probably display without, either based off claims or other data that we're collecting that we have internally.
And this is Grace. I just want to make one comment to update our discussion on breastfeeding.
Yes.
That I've had a preliminary conversation with my academic partner, who's an expert on this, about what might be the best indicators and the best sources to accurately document breastfeeding, and we're going to follow up around what's the way to make it as simple as possible, knowing that it might take some additional data collection. So I'll get back to you about that. And my hope is that there can be some follow-up process on that to better flesh out the sources of breastfeeding data and what the indicators should be.
Great. And I think hopefully now that we have the opportunity to continue to work together collaboratively, this can kind of be our initial stake in the stand, but not necessarily the final version, if that makes sense. So I think as part of our charter, maybe we have a plan for revisiting some of this, and whether that's evolving this or trying to be parsimonious about how things are displayed, or, I think, Ben raised a good point about who's accessing this data can be overwhelming depending on how it's displayed. And I think that'll be an important piece of how we think about this. I know Susan's really interested in the user interface as well. So, but other thoughts about this? I think, we're trying to make sure that we're hitting various pieces of kind of population health and well-being here. And we may need some more oral health measures, though I included those under, I think, in the next slide, which we'll get to here. Some of these we have easy access to. Or should I go ahead, Kate? Did you want to weigh in?
Sure. Yeah. No. So just to say out loud, I think we discussed this briefly during the last meeting, but as the Connecticut HIE really comes into being, Connie, I think there's going to be some new opportunities for routinization of the availability of this data and greater ease of use from a standpoint of accessibility for us. Also, OPM, in conjunction with the Department of Labor and now almost all of the Human Services departments, has been working on this P20 WINS initiative, which is around interoperability of the data sets across departments. That's also going to be, I think, a great platform for, again, routinizing this effort, which has had to be painstakingly constructed on a sort of case-by-case basis, through data use agreements and a lot of, kind of sweat equity amongst all of us. And so I think we're poised for action on so many of these things, especially where the data is housed in our sister departments. Final thing I want to say is, well known to all of us, is some data sets have a lot of provisos that limit sharing and around the kind of fundamental premise of privacy and protection against bias, all of which is extremely compelling and important. Some others are more accessible. So I point to the DOC data as an example, rightly or wrongly, not as freighted with some of those constraints. So we'll be looking at how fastly we can, pull some of those things in. And I just want to remind everyone, kind of an inaugural effort of this type of work that we've done is the CHESS initiative, matching the homeless management information system data that is housed and stewarded by the Connecticut Coalition to End Homelessness, matching that with Medicaid claims data. And we strongly endorse, we concur that this has got to become a regular practice of our program to really identify disparities, but also to inspire opportunities for better supports for folks that are on the preventive end. So all those features, I think, are going to be more conducive than they have been in the past in terms of us accomplishing that.
The other thing I'll just add is I think, the challenge will be, again, making what we're displaying in data making accessibility as much as making data as accessible as possible for what we have available, but also making it that people aren't overwhelmed by this. Because you can imagine if we had all of this, it could be overwhelming depending on how we display it. And so we're also going to have to think about, like, how do we prioritize? What are the key things that we want to display up front? And I think part of this, hopefully ongoing work of this group can be like, how do we prioritize that and for who? Sandy, please go ahead.
Just to go back to what Grace was saying about breastfeeding, that is, I agree that that's something that's problematic to kind of, figure out how you're really going to interpret. And I think, at least in the, again, pediatric population, obesity is another. It's such a large just group, and how it's relatively easy to identify if you want to use BMIs, but then what the next steps are, there just aren't. As everyone knows, it's a multifactorial issue, and there's so many things that are involved in it, and the access to any kinds of services that are helpful, or at least have some track record in being available, is pretty low. So I just wanted to spotlight that obesity is such a huge term that maybe at some point we need to narrow it down a bit.
Thanks, Amy. I think this maybe some of that work we'll need to do moving forward to really serve. And also, one of the challenges we might face internally, and so Kelly, I'll get to you in just a second, is what information do we have? Is this based off of just claims and someone saying there's obesity versus actual BMI? And I think just recognizing some of the limitations of the data we may be presenting is going to be an important piece of that, and recognizing the limitations of some of the data. But Kelly, let me turn it over to you.
Hi, thank you. Sandy, I appreciate you bringing that up, not only with, children and adolescents with obesity, but also with, we need to obviously lifespan that into adults, and maybe we need to slide in there bariatric numbers among Husky members. I am a very successful bariatric surgery patient. 9 years ago, I had it, and it, for as many people who, there's a lot of folks who aren't successful on it now. And I'm not sure why I see for instance, for like Facebook groups that I'm in, why when I first had it done and it just seemed like the success rate was really high, as to now, it just seems like a lot of folks don't ever reach their goal weight. And how we can support them, especially for Husky members. And if you're on food stamps, trying to access, the quality of food, and then there's vitamin regimens, and things that aren't included. I'll tell you the protein powder that my doctor required me to get, it was like $45 for a tub. And, $45 for consumers who, are on Husky, unemployed, don't, stable housing and all that, that's a big chunk. And so then they're going to, I've seen people doing Carnation instant breakfast because that's what they can get on food stamps. So I do think that, obesity, then tying in, whether it's claims data or focus groups with bariatric patients, because it's so prevalent now. And I think that also promoting that it is only a tool and that it's a lot of hard work and it is not the easy way out at all is something we should stress to help folks be successful in trying to overcome their obesity. Thanks.
Thank you, Kelly. And I think you maybe highlight one of the areas that, at least for me, is a blind spot, is I think surgical outcomes and other things that I may be less focused on as someone. And I think not just bariatric surgery, but potentially other surgical outcomes we may be interested in displaying at some point. Maybe that in a second, but I appreciate that thought process. Thinking about, how can you look, do we actually have the data to look at someone who, again, this sometimes comes back to like, what's the quality of our data? If someone, we can probably figure out based off claims they had bariatric surgery, but do we know, are they still obese? Are they coded as obese historically? And has that changed?
And tying it back to the comorbidities, there's the behavioral aspect of clearly you don't have a good relationship with food. And so you have to work on, changing your mindset is the absolute key to it. But then, generally all the comorbidities, the high cholesterol, the diabetes, the, high blood pressure and all those things, so then that could be tracked as well, going back in the claims data with follow-ups with bariatric. So that's one way to tie it in for an outcome.
Thank you, Kelly. I'll move on to the next slide here. This is just some of our individual social and other things related to social determinants of health, including REL data completeness, which I think is an important part for us. I know NEMT, there's already a dashboard being developed. These are things in access to transportation kind of going hand in hand. And also we have internally the percentage receiving SNAP TANF. There's some other things that we identified that I think at the individual level would be helpful to capture, which may be, again, a phase 2, just since we're not doing it currently, but not that it shouldn't be done. Karen, please go ahead.
Yeah, and this, I apologize. I'm getting older and I'm not sure I'm reading all the lines correctly, but I didn't notice on the earlier slide anything about churn, either with, among Husky programs or between Husky and Access Health or on insurance. And the other thing that I haven't noticed is, oh, sorry, it just fell out of my head.
No problem. I was just going to say that's the next one is the enrollment numbers. So I just want to
gotcha.
That's helpful.
And the other thing I was thinking about was the PCMH plus specific quality metrics that focus on community clinical integration. I know those aren't collected across the program, but they could still be interesting to look at over time to see whether or not efforts to, to change culture are successful.
Sorry, I think I asked you to unmute by accident there, Karen, but yeah, thank you. That's helpful. Maybe we actually call that out either in special populations or something, because it's a not really a subpopulation, but it is a subgroup of data that we have that we might want to display in a specific way, but that sounds very reasonable since we are collecting that information. Okay.
Yeah, and I'll just wrap around. I appreciate that point. I think it's great because that is definitely an available piece that we can tap. On the churn, and I know this is a familiar conversation to you, Karen, we will definitely engage with Kristen and with our Access Health colleagues. That is something that is somewhat limited in capacity right now, from the standpoint, especially of the relationships that I know many advocates have been interested in, especially between children and parents. That to the extent that we're capable of doing that, we share an interest in reporting that as soon as possible, and then devising means to associate people in that way. It's just, I know, been a longstanding challenge and is not an acceptable resting point in any of our views.
I appreciate that. And I would just chime in and say, I think it's especially important right now with the end of the public health emergency coming and new programs being put in place, just to make sure that the transitions are seamless, right? There's a lot of change, and that's just ripe for administrative glitches that can cost people their coverage. So that's why I'm raising it again now.
Yeah, it's a fair point about the end of the maintenance of effort requirements. Also, the launch of the initially state-funded wraparound of exchange policies, which will later be Medicaid claimed for those individuals, with the wraparound for the subsidies for cost sharing and premium assistance. Also, the rollout of the extended pregnancy coverage and the new coverage for undocumented folks. Many of the current mechanisms are very conducive for ensuring that people migrate appropriately among sources of coverage, because as is well known to most in this group, I'm sure, there's a shared rules engine through which Access Health adjudicates eligibility for the modified assisted gross income groups, A, C, and D, A and D, as well as CHIP. So that does give the backdrop of an ability to associate people appropriately, especially with a Medicaid coverage group. We've seen that unionized very successfully, and we've also seen auto enrollment, where we're essentially sending people pre-populated enrollment forms, and essentially we just have to correct what is new or updated. So I think so many of those features have been conducive to reducing a lot of the incidents of migration on and off that we saw in the past. That PCMH Plus in particular was an incredibly important bellwether for us in terms of understanding the extent to which that has occurred historically, and the relationship of migration on and off to continuity of care, and meaningful opportunities for quality-based accountability, like through the PCMH Plus approach. So we truly do understand the relationship of that to the outcomes that we want to see changing and improving. So it is just a work in progress, but I think we're in a much stronger position with continuity than we have been in the past on the basis of that health insurance exchange arrangement. I just want to remind everyone that we're a tiny minority of states that still maintains a state-based exchange, and it really is a strength of our landscape.
Thanks, Kate and Karen. I just went ahead and moved on to the enrollment, access, and churn question, which hopefully everyone's had a chance to look at. Again, I think some of this, Kate, as you alluded to, we need to be able to, there'll be more things that we'll want to be able to do in the future. And I think, Karen, you highlighted the reason that that's important for this point in time. Sandy, I'm going to turn to you.
Yeah, I was just wondering where a number of adults and children with a primary care visit in the past year, is that going to be because kids under 2 should be having a whole lot more than one primary care visit in a year. So I think we need to make sure that that's somehow related to what's appropriate and what standard of care, and where they're getting those primary care visits, because I know at least in the past, some of the urgent care facilities will do, quote, school exams that look like primary care that really, in the claims data, that really aren't necessarily what we would consider true primary care for kids.
And I think this is maybe included on more under wellness visits. That was this is under population health, but I think, I guess the question is how we're going to couch that, but I would agree that's an important thing to be mindful of. The access is kind of more of like, are people able to access these services? It's kind of a very may not be the best way of marking this, but it just kind of indicates, like, are people going to providers or not, to behavioral health? Are they, one is, it may not tell us exactly about access, but it'll tell us about utilization at least, which may be a marker of access. So it may be a poor proxy and maybe something we want to revisit, but I appreciate your point that what definitely isn't going to be capturing how many visits, a child under 2 should be having for routine care. Okay. This is the special population, kind of, maybe we would add maybe PCMH plus underneath here. It's just because they're included. It might be easier to call them out underneath this, but these are just the ones that we initially had identified, and that we have some access to some of the data, but maybe not all of it as of now. And actually some of the perinatal services with our maternity bundle will be probably opportunities to really think about that particular population as well, in terms of some of the newer quality measures that we'll be hopefully monitoring in light of that. Okay, so, and this is the managing costs. This is the specific one. I want us to be also just asked to think about, we want to call this out separately from what the finance subgroup is doing, and how do we intersect the two, and do we want to keep them separate, or do we want to remove this and really put this under finance, or do we keep these together? And I think I would turn to the group here to help with that. And I think one of them is, and maybe this is a reason to keep it, is if you look under phase 2 outcomes, over and underutilization of healthcare services. Obviously that needs more specifics, but in general, is that something that the finance subcommittee would be interested, or really is this obviously it pertains to quality and also access to a degree, and also, but it does have an impact on cost in terms, especially for overutilization, or for underutilization, where we want to see more resources that need to be put in. So let me stop talking and see if people have thoughts about this. Please feel free to jump in.
This is Grace. I'm not so sure it's about whether they should be merged, but somewhat implied in what's written here, but the point we've made throughout this process, I think, is important to flesh out and make more concrete in the future, which is the importance of what might seem like expensive investment, but if we look at savings in the longer run, end up saving money. And so thinking about cost benefit, if there's an infusion of cash, say to increase primary care investment, longer term, what might that do? Rather than just a quick turnaround of the immediate to look at how much was saved. So I think that needs to be conceptualized and made more concrete, and probably, as I've understood, might involve some advocacy at different levels. I think it would be very important to the success of this whole framework.
Thank you, Grace. And I think the second phase 2, the efficiency relation between strategic aims and around quality, efficiency, and spending, we may be able to elaborate on that and call out even specifically like a long-term benefits to upfront investments or something along those lines. But it seems that's an important part, and I know part of kind of even what the finance subgroup meeting discussed briefly is like that linkage between investment, quality, including both short-term and long-term, which I think we have some, it'll take some effort to do, but it's worth thinking about how to do this. And maybe that's part of the ongoing work of this group, is thinking about how to advise on us doing that more effectively.
Right. I love those points too. And, just 2 brief comments. One example is, that this state has deliberately layered primary care investments. The retention of the rate bump that was initially authorized under the ACA, the pay for performance incentives under person-centered medical home, the layering of the advanced care coordination payment and upstate only shared savings arrangements with PCMH plus, and then some other features like EHR funding that have wrapped around primary care practices. there are numerous indicators that we could capture that have improved as a result from the super processy type of measures like incidence of providers. Over the time since implementing those, have gone from 1,100 primary care providers to over 3,000, to a lot of the indicators around use of ED and hospitalization, but also the CAPS data, the experience of care, dramatic increases in the expediency for scheduling of appointments, and also respect that people have felt. So it's a non-inclusive example of long-term investment yielding across many types of indicators that are important for the Medicaid population. Another piece is the way we've mapped the investment value of the supportive housing services under CHESS, not unique to savings in the Medicaid program for foregone ED and hospitalization and skilled nursing facility, but how that spills over into the efficient use of housing vouchers from the Department of Housing. So cross-sector budgeting in that respect and looking at relationally. So Grace, I'm really interested in that, and I feel like there's some areas that we could easily start with now that would capture what you're intending, if that feels right to you. I'm interested in your thoughts.
Sorry, on mute. Yeah, that sounds great. And, there's been such progress made already. And I think if we look at some of the areas we've articulated here and think about what it's going to take to do it, some of it, if it seems expensive, but in the long run would save money, I just think we want to make sure that framework is consistent.
Thank you. Mike.
Thanks, Brad, and thanks to everyone for comments. This one in particular, I think the issue of how we appropriately capture this is a good one to raise. In regard to these particular areas, I guess I would have a greater comfort level, if you would, if we kept the description here at a little bit higher level, because I feel like what we're trying to achieve, or at least what we talked about trying to achieve through the finance group, is to make sure that we try to, as part of our phase 2 activities, right, how do we try to align both investments, which have been spoken to, and quality outcomes to financial measures. So really, I feel like that second bullet captures more, I think, the intent of what we're trying to achieve. It doesn't have the word, it doesn't talk about investments, if we wanted to modify this slightly, but I certainly think it's implied by the use of the term strategic aims. But it's that area that feels a little bit more of what we're trying to achieve versus over and underutilization of healthcare services, which is a sort of a specific, perhaps quality related outcome that doesn't capture the broad-based intent of this particular area. So I don't know if that resonates with people, in terms of trying to keep this one broad. If we are going to try to tie it into the finance piece, it feels like it should be broader in nature, as opposed to, capitalizing on, say, that first bullet there about the utilization of services, because it really would capture, I think, as many elements of the quality perspective as we could and align financial measures with those various pieces. And just because I'm struggling with, and I just want to mention on the process measure, timeliness of payments, we are more than happy to track that and put that out there from a transparency perspective. I guess I'm just trying to make sure I understand the more clear relationship to quality, and whether that really hits sort of the depth of what we're trying to capture in terms of making relationships between quality and quality outcomes and financing, either investments or spend. So I just wanted to make those comments and would appreciate what others think about that.
Yeah, Mike, before we have other people weigh in, I agree. I'm a little fixed on that also because, just for everyone's knowledge, we do pay every 2 weeks, 100% of clean claims. I think that's really different than what was the case historically under capitated managed care arrangements. It's also very different it's much different and faster than most commercial plans. So timeliness certainly we can document that. And I think we were readily able to do that. But is that kind of the best type of process indicator of what's listed in the left-hand column? I think is the question Mike is asking. Maybe it's timeliness plus something that helps to explicate the category of service spending and the alignment over time. Timeliness just seems a little bit rudimentary for what we're looking at here.
Okay, Mike, would be interested to hear others' thoughts on this and whether this is something where maybe we're less specific upfront, acknowledging we need to revisit this as part of our next, as part of our further processes, because I do think it's one of the areas that we haven't been able to flesh out quite as much. And so maybe it makes sense to keep it at a higher level. But I would very much welcome, Bonnie, please jump in.
But I guess I'm wondering a little bit if possibly sort of the straightforward utilization that we have considerable tracking on would in some ways be considered then a process measure, sort of just the amount of utilization, the amount of services might help, similar to what you just said, Kate, capture what's in the outcomes. So where in that lower box about over and underutilization and quality and efficiency, we're really getting at complex and comprehensive and integrated understanding. The process measures might be sort of the straightforward utilization individually to some extent, just capturing sort of the how much of everything that is going on. And also consistent with the points before about ROI, maybe we could further elaborate in the first box where we mentioned quality, efficiency, and spending, just sort of maybe adding there, it's spending, it might also be savings, or to capture the point about investments.
Thank you, Bonnie. Others' thoughts on this? I mean, I'm wondering if, again, we kind of focus this down under really that kind of comment, Mike, that you highlighted, and Kate, the efficiency relationship between strategic aims around quality, efficiency, and spending, and then highlight the need to also evaluate return on investment, cost benefit, and savings opportunities. And then we kind of, as part of the continued engagement with this group moving forward, realize we need to spend some time thinking about how we're actually going to display this and what this actually looks like, acknowledging that we may not have a great, and our answer is more broad than it is for some of these other points that we're making in the quality measures component. Does anyone feel differently? Bonnie, go ahead.
Just that in the box on focus groups too, we could add the points that you just made about also directly asking members about their experience with costs, but also sort of the alternatives, the ROI, and their input on sort of what was mentioned before. If only we had maybe particular preventive service covered or alternative covered, they might have avoided ultimately a surgical procedure or something else that for various reasons was much less desirable.
Mike, please go ahead. Thank you, Bonnie.
So I just wanted to Bonnie's earlier comments. I think that if others are comfortable, I think the way that she presented it, made a lot of sense to me. I think if we wanted to sort of slide utilization over to a process measure, unless that's captured somewhere else in our framework. But I think having that as more of a process measure that we would report on, no commentary on over and under, but just, you know, putting the data out there. What's utilization look like by service? I think, you know, that at least to me, sort of that resonates as a process measure as opposed to an outcome measure. You know, for now, we can work on the outcomes as we develop the quality piece and drive that forward. And then, you know, adding something about return on investment or some investment oriented language into that bullet around efficiency and strategic aims, et cetera. I mean, that seems like a really good way to capture what we've talked about.
Thanks, Mike. I'm happy to, I'll take a stab at taking some of this, modifying it, and then sending it out for feedback. We're kind of trying to capture these various pieces, but recognizing we'll need to revisit it in the future, but still trying to include things that we think are useful, including maybe just utilization report outs. Okay, thanks everyone for this really helpful discussion. The only other piece is the Transparency Board finance subgroup component that we wanted to briefly highlight. So the comments at the last meeting were kind of mentioning the integration with quality. And so I just highlighted what was changed here. And thanks, Mike, for convening and that discussion. But integrating, so under phase 2, integrating quality data directly with financial data, such as PMPM by service category and HSCE components. For example, linkage between primary care investments and network access and or enhanced health outcomes. And obviously, I think this directly relates to the conversation somewhat we were just having, but I think it's, you know, it's reasonable to call out because this gets us the integration between quality and cost is really important as we think about displaying where we're making wise financial decisions, or maybe where there's areas for improvement. I think thinking back to our C-section rates, as we're thinking about a maternity bundle, we know C-section rates are too high for especially women of color. And so as we're building our new maternity bundle, how do we help drive those rates down? And what are the components of that? But using then data to tell us how we're doing. And that's just one example, but I think we could using that as a kind of an example of how we can think about this moving forward. Any thoughts or comments on this? Jim?
Yeah, just one other component of this, and it is related to what we talked about. Sorry, I had to drop off for a bit. So one of the things, although the linkage between primary care is really important, I do think we need to have some insights in their access to specialty care. It is something we hear a lot of problems around at times, is that, and I think it does lead to a lot of avoidable utilization simply because of that access. And there's multiple things we can talk about, the barriers there. But having some insights as to the appropriate use of specialists given the population and the risk, there should be a fair amount of data that could give us some senses, do we have a problem there and are we addressing it? And so however we want to highlight that would be important because I know it's a challenge.
Thanks for that. And I think this is just an example, maybe just calling out, even under our utilization of services in the last slide, we could even call out specialty care, or just even call it out in this and saying the linkage between primary care investments and or specialty care access and health outcomes, something like that, just to be explicit, because I think you raise a good point. Karen, please.
I was just going to say that, you know, building on the last conversation and also on what Jim just said, also capturing savings related to preventive care here, and thinking about, you know, if in areas where there's more likely to be a fair amount of underutilization in Medicaid than overutilization, and just using context to explain that investment in driving services, whether or not it's investment in primary care, may be necessary. So I think I'm just asking that there be a little bit more context around some of the financial data in alignment, I think, with what others have just said. Sorry
about that. Thank you, Karen. I think just recognizing that this that will be an important part, and maybe that's something that we should be revisiting as a team or as a group moving forward, is that component. I don't know, do you think we should say something specifically under our phase 2 of the finance board? Do you like add language? I'm just curious to your thoughts on that.
I would just say, I mean, I would maybe make it a little bit broader to primary care and other investments, and enhanced health outcomes, and long-term savings, maybe something like that, right? Because we don't often capture the end results of long-term savings.
Point well heard. Thank you. Other comments, thoughts? Okay. So the next part is really just reviewing where the draft of the report is. And so some of these comments, that discussions we've had today will lead to that, but we at least want to, guys, preview this for you so that you can provide any initial feedback. And again, with a plan of sending out the kind of final draft report to you later this week, because, and as I think we discussed earlier, the report's going to be in a deck format, similar basically like you'll be seeing shortly, that will be for public consumption moving forward. So making sure it's clear and transparent, given we have a transparency board, some transparency around our presentation here. And so once this is finalized and submitted, this is just to kind of highlight the date, but this will be the first slide on it. Is this the report from Advisory Board for Transparency on Medicaid Costs and Quality? This is the outline as of now. This can be updated, but going through the executive order, board members, Department of Social Services 10, initial phases of work, goals, key decision points, work groups, principles of data use and oversight, quality measures, financial measures, visualization, and then meetings and video links at the end as well. Again, this is will be the kind of report as sent. So I don't want to go through this in detail. You can feel free to review this, but this is just the executive order as well as a brief summary of what this executive order, how it came about, as well as the full text if people want to review it. So that's kind of this first slide. And at any time, I'm just going to go through this, but if there's comments or people want to, please just interrupt me. Again, this is kind of previewing this so that you know what you can tell us if there's anything missing. You'll have an opportunity to review this before we finalize it. The next, there's appointees. The one thing that—
Brad, I'm sorry, could I just briefly interject? So for fastidious people, I'm one of them. I just want to acknowledge this EO still hasn't been reissued by the governor's office to extend the originally required deadline for the report. The office of the governor is absolutely on notice of this. And I as you might imagine, they've had a lot of priorities with reviewing the continuity and sunset of a very broad range of executive orders. So I just want to say this out loud. We don't feel concerned that deadline has passed. There's an expectation amongst all involved that the report will be conveyed in July. And I just wanted to make sure to say that out loud because I know that people have inquired over time. Thanks, Brad.
Thanks for pointing that out, Kate. Appointees, this is missing the folks from various agencies on here, so that will be added just of note. So my apologies for people if they're currently missing. This is the initial appointees, so everyone should be hopefully listed here. This is the statement of intent that kind of from the DSS around this work to help instigate, to help kind of push it forward. And some of this, I think, came out from the commissioner in our first board meeting together, and kind of from some of these contents. Again, statement of intent really from our department. The initial phases of work, this is actually pulls in the presentation that was done at the first board meeting, so people can reference that if they'd like to, and then other examples of some of the currently available DSS work is available, though may be harder to find for folks. And then this starts into the goals that we've outlined as the transparency board. This just comes from earlier on in the this is nothing new. This is unchanged from the last few meetings. Here are key decision points, same thing, unchanged, just slightly reformatted. About our audience, the vehicle platform, data stratification, access, and comparison. These are the work groups. I haven't put everyone that participated in the work groups, but I will also do that just so that for transparency purposes, that people are aware of who is participating. Just tried to outline a high-level overview of what each of these work groups kind of was focusing on. This starts to go into the actual slides themselves. So these are the principles of data use and oversight, really unchanged they are unchanged, I think slightly reformatted from the last meeting, but language is unchanged here. Same things here. This will be in the final report, just as discussed, all the information as we've already outlined from our subgroups. And then, actually, I think I need to move that around a little bit. So that might be on me for formatting. Let me just make a note to myself. This is actually the distinct goals across the 5 phases. I mentioned this before. And Karen, this might be the time to bring up one of your questions about like, do we need to set a timeline or not? I think you had raised that. And so these are taken from each of the kind of groups that we're meeting, visualization less meeting, but more of what Susan had presented, and try to pull out the different phases so that there's at least some alignment. The question I think becomes like, do we set a timeline or not on the various phases, or at least for the quality measure? I know the goal is kind of to have it ongoing for all of them, but I think, let me turn it over, Karen, to you for a second, just to kind of focus again on your comment to make sure we're discussing it and answering it.
I just think it would be helpful to have some sense of a timeline and benchmarks within that timeline for when each piece is expected to be completed. I think we talked about this a lot early on, that the phrase aspirational was a concern to a lot of us, because that can often mean maybe never or sometime in the indefinite future. And so having some concrete goals around this would be helpful.
Sorry, I recognize I'm muted. I'm wondering if with the kind of recognition that we're now going to be taking this work forward kind of together, if that's part of what we do as part of our charters to help outline as a timeline rather than do that at this point. I don't know. I mean, I don't want to preclude this from occurring in terms of us doing it now. But I also want to be mindful that if we set, maybe that's something we do in the next phase of our, like the first meeting for our charter work or something like that, is we help provide guidance and timeline guidance or something like that. With that said, that may not meet kind of your goals here, Karen, or what other people think we should be doing. So let me turn it back over to you or others who want to make further comments.
I mean, I could see the group doing that going forward, but I would, if you're talking about meeting quarterly, what's the goal for the first quarterly meeting? That just some very basic, what are the benchmarks? What are reasonable expectations? And again, understanding that this is an iterative process that will involve, like the phrase Susanna used, the ongoing curation of the metrics. But process should still have some benchmarks and some deadlines, hopefully.
Thanks, Karen. Yeah, I know I struggle a little bit, at least knowing what reasonable deadlines are for this at this time. Though I think we probably all would like it to see it done sooner than later, but acknowledging some of the limitations that exist. What do others think? I just love to hear other people's perspective here as well, in terms of like setting as part of our final report, whether we set deadlines now or whether we come back to that as part of our process in the future.
Yeah, Brad, I don't want to interrupt any comments that folks would like to make, but I think it might be useful for DSS folks to circle on this. Later stages of the slides that Brad will be reviewing have specific timeline for the data dashboard. And I think so much of the successive steps relate to feasibility. I think it would be useful for us to talk to colleagues, including our eligibility policy colleagues, and also colleagues at other departments like OPM around that P90 wins initiative. I keep conflating that with whatever that exercise regimen is. So I'm sure I've said that wrong for anyone who knows exactly which number I should be putting in with that. But I'd like to suggest, Brad, I think from a standpoint of seeding the discussion, we could do that and come back in the future stage of this group, if that makes sense.
So this is Grace. I think that it might be useful to refer to timeline in this report in some way without committing to very specific ones, but therefore there's at least a commitment to creating one and a general framework for timing with reference to needing to fine tune that based on feasibility and the other things you said, Kate.
Maybe I'll go quickly to the timeline. I'm just going to skip over some slides because because Susan had kindly put together some, at least for milestone one, which obviously getting the dashboard off the ground is probably one of the, it's probably one of the most important timelines that we actually get something up that we can put data into. And so I don't know if this helps kind of meet in the middle in terms of we have some timelines for the dashboard itself rather than for the data pieces, which I think, as Kate mentioned, there's a lot of process pieces maybe internally at DSS and also at other agencies that we're going to need to kind of work through to determine how, and actually probably maybe present that to the ongoing board to say, here's where things stand. Is there feedback to us as an agency at that point in time? But I'd like to welcome Karen, Grace, and also make sure Susan, if you want to weigh in at all. And Grace, I know you said there's some timeline. Would this meet, like from your, this is really around more the dashboard than the data piece. Do you think this is this a kind of a happy medium where it's maybe doesn't include all the data, but it has some timeline in terms of publication and enhancement and things? And,
so I guess I'm a little, maybe I'm just not following very well, but the phases that were described earlier of, sort of immediately accessible and then continuing out to things that have to be further developed or completely developed. It seems like those sort of things that need to be more rigorously worked in order to produce and report on are not reflected here. And I think that's what you were referring to, Kate, is that would take some internal conferring in order to get a good sense of what those timelines would be and what the real workload would be. So I think it would be helpful to refer to that in some way and say either at this point, the general timeline seems to be completion by X time, or there will be a more specific timeline for these pieces developed by X something. So it shows, I think those that will see this at the governor's level and the public level will see that there's a commitment to bind this into a timeline, even if there can't be a specific one for all of it produced right now.
Great, Grace. I appreciate that point a great deal. And maybe we can even, so certainly we could signal date certains by which we will have a plan for those phases. I think that's entirely reasonable. I think also signaling next stages, first of all, the continuation of this group, and then the scope of work for continuation we want to articulate in the report. So we're kind of signaling that. And in that, I think we can identify as a specific focus area, development of a life cycle for these later stages. Does that make sense?
I think so.
Yeah, I agree. And I think maybe one of the charges of the group in future could be fleshing out plans or timelines for addressing what may be currently infeasible but should not be infeasible indefinitely. I'm thinking specifically about completeness of race, ethnicity, and language data, that's often cited as a barrier to looking at disparities. And there are plenty of opportunities for improving the completeness of that data. So kind of looking at what's behind the metrics and how we can get to improve it.
Right, great point on that, because those involve kind of constituent commitments around different business practices, around the eligibility process, around socializing, the need for the data with members, et cetera. And you raised wonderful points around that we can undertake as companions that are not just sort of, that enhance the feasibility of it. So I hear you, Kim.
So, and I'm just going to summarize my understanding, kind of, I think where we've come to is that make sure that this links to that other phases of work, so that that's clear that this is kind of a timeline that is tied to that other slide, but also call out separately that we need, that there's a commitment to creating a more clear timeline by the continued engagement of the oversight board, essentially. I want to make sure I'm getting that right. I think that's just making sure we're being very explicit that that's going to be part of the ongoing work, is really creating those expectations and helping create time commitments for some of this work in collaboration with DSS. Susanna.
I would just add, Brad, I really appreciated what Kate said, right? So I think, in the world of both transparency and feasibility, the more that the DSS can say, here's what we think we can do, and be willing to say, we think by this date we'll have adequate data to do whatever. Even, the advisory board can certainly contribute to that, but I agree that in some ways what we're looking for is you guys to do the best you can to say what you think is going to be feasible when, knowing that, surprises happen. I think this milestone piece is great, and agree with some of the other things that have been said about how, I think what I'm most curious about and really just don't have insight into is sort of, what the time span is for getting access to measures that are existing data, but that aren't sort of in Susan's hands today. And to have some sense of that momentum would be great, knowing that it's not entirely under your control. But I think a lot of that really comes from you all. Rather than us.
And maybe we can add a point to that to say in collaboration with DSS or something like that. So it's a collaborative process between the ongoing engagement of the board that will oversee the process that DSS might outline, something like that. Okay. Thank you. That's really helpful. Any other thoughts on this? And I'll head back up to the other slide in just a second, just because I know this connects directly kind of to that. Okay. So this is where we left off. Suzanne, I see your hand still up with that legacy hand. I just want to make sure I'm not missing anything. Legacy, I got you, no problem. This is, we already reviewed today. This was from our quality measures detail phase, and actually this is the same thing that, sorry, oops, I'm going the wrong direction. The same thing that was included previously, so needs a little bit of updating. Oops, oh, sorry, I didn't actually move down those other slides yet. So what I'll be doing is taking the slides from the quality measures that we just discussed, updating that, the financial measurement component or measuring costs component, updating that, and then moving it down to the final presentation. This is the Transparency Board Finance Server. We reviewed this language, maybe with slight modifications as we discussed already, so I will do that. These are the kind of phased high-level benchmarks we've already reviewed. Same thing, these are the same slides as previously, just including them in here from the finance subgroup. And then this is part of the dashboard and visualization stuff, and we got to a few of those slides. I think I'll work with Susan to maybe modify these slightly so they're maybe slightly more in line with the other parts of the report. But I think we already just reviewed this in terms of the kind of clear timeline for the dashboarding piece, which obviously ties to the other stuff we just discussed in terms of a timeline for the data, which we need to circle back on internally. And then this just highlights those milestones for the visualization component and the phase 3 as well. And then this will be this needs to be updated. I don't have the link for the March 30th one. And then we did stream as of this last meeting to YouTube, so people can actually review these on YouTube. Some of the other ones are actually previously not on YouTube. So I think this process has generally worked quite well in terms of how we're streaming it and making access to it available. And then, oh, sorry, actually, Kate actually did put those slides in, and I moved into the appendix. So I need to call that out probably. So one of the questions was in the report, including this level of detail in each slide, or actually putting this as the appendix of the report, essentially, with this amount of information. And I think the thought was actually to maybe do this put this at the end as an appendix for all this information, because it is quite detailed as opposed to the rest of the slides, but obviously including it as part of the primary report, but just moving it towards the end. And then next, and this is not part of the report, but this is going back to our next steps, is kind of goal of sending this to you by July 1st for feedback, and then submission by the 8th, essentially, as finalized. So that's basically the end. So one, I want to just ask about overall any comments. Is there any big pieces missing from this report? We did discuss a few things. So, but are there any additional pieces that we haven't discussed, or any comments that anyone would like to make? Sandy, please.
Just, and this may not be necessary for the audience for this, but maybe defining some of the abbreviations.
Yeah, well made.
Yeah, there's quite a few. I'm sitting here thinking, wait a second, what is that? So that might just be useful.
Appreciate that. Good point.
Brad, what's the process with a report like this? Is this something that's being put out primarily as an informational, or is this a seeking of additional input from the public? What happens after this?
We'll ask Kate to weigh in, as I am unable to answer that effectively.
So great question, Susanna. So what the board will be doing is issuing this report to the commissioner. So it's an advice and comment of the board to the commissioner. The commissioner will then convey it to the governor's office. I don't know in advance whether the governor's office and the commissioner will want to issue a press release. That's typically something that does occur, but again, we'll have to see what their level of priority is. We will also then plan on behalf of the board to present the report to our statutory oversight bodies, the Medical Assistance Program Oversight Council and the Behavioral Health Program Oversight Council. I'm very happy to take suggestions of the board about other important stakeholder groups we could share it with. But that's really the kind of expected procedure of it. And in the context of MAPOC and BPOC and any other stakeholder bodies that would be commended by this group, we will definitely roll up feedback and then convey back to this group. So there may be refinements or kind of future action that this body will wish to take based on that. And again, if there's also comments on what would be most useful to you in that respect, we'd be delighted to hear them.
So Brad, I realize you're sending this report out in like a day. And we've only talked around the edges of this, so I don't know if this is feasible. But in that context, the two things I feel like I wish were here that I think help set this up is we refer sort of offhand to other states, but sort of trying to share with the commissioner and your advisory board sort of how much this sits outside of what's happening in other places. I mean, again, I'm sort of harping on this. I think we'll see a lot of states going in this direction, but I think it helps to talk about how the ways in which this is a distinctive effort. I think that serves you guys well, but also helps put this work in context. So if there's any way to just add a little bit of language about sort of how this compares to what's happening in other places. And then I would love, and we haven't talked about this a lot, so it just may not be feasible to incorporate this time, but we've talked a little bit about sort of what's supposed to happen with these measures, right? I mean, you have that nice statement of intent at the very beginning, but, you know, I'd love to see, you know, we anticipate that this will, you know, lead to changes in value-based contracting, or will lead to whatever, right? Like, how does this work that we've done actually, you know, what happens from this that might lead to improving the health of folks in Connecticut? So that framing, I think, so it's a little less just kind of what did we do, but a little bit more sort of why and how does this stand out, I think would really help people understand why this is important.
Thank you, Suzanne. I appreciate that. And maybe those are thinking about, can circle back about ways of incorporating something at the top as well, that maybe some more framing, I think, as you're kind of alluding to, in terms of not just the goals, but how does this lead to improved health potentially, or at the very least, including how much of this is outside the scope of maybe what's already being done. Yeah, I would welcome others' thoughts on that. And also, you know, is that something that is definitely missing? Should that be included in this report? We can definitely try to put something together at the top for people to review, potentially, that hit both of those points, or two slides that maybe one hits one hits the other. But just would welcome others' thoughts on that.
Yeah, I think it's a great point to bookend the statement of intent with, you know, really specific anticipated application of the use of the, you know, what we're seeing in the trends of the data. So totally concur on that. You know, we can definitely reference some of the exemplar states from a standpoint of transparency and dashboarding. You know, we featured a number of those at the outset of the work of this body. Also, I know Karen had given us some very useful cross-state comparison information about states that are on the leading edge of the use, particularly of the race and ethnicity data. I think we haven't done a formal kind of environmental scan, but we can make at least those types of references in terms of what we're looking to leap off of, and then, you know, the additional breadth, particularly around the population health measures, might be useful. Does that sound great, Susanna, with your intent?
Yeah, no, exactly. And I think the environment is changing fast, so I'm certainly not an expert on what other states are doing, but I think exactly as you said, a little bit of the framing.
I really like that. And if I could just jump in and add any context in terms of how this fits in with other efforts from Medicaid and within the state would also be helpful. So what is the connection between the, you know, the work around the maternity bundle and the transparency project, for example?
Thank you, Karen. Any other pieces of feedback or comments on what Karen and Susanna had said? Okay, well, seeing none, I'll first take the opportunity just to kind of wrap us up briefly, and then turn to Kate as well. I just again wanted to thank everyone for their continued engagement here, and excited to still be able to collaborate and work together on this moving forward. I think this is exciting work, and that we've been working on together, and I think there'll be a lot of obviously work to get this off the ground and move forward, but I think we probably all see the potential of, and maybe don't even see the full potential of what this could do for not just the agency, but the people of Connecticut that DSS is taking care of, and as the entire population, if we're able to pull some of these things together effectively. So I'm just appreciative of the of how much people have been willing to give of their time and their expertise here, and just really, really appreciate and look for, and really so glad that we have such a wonderful group of people that are willing to that have been willing to engage in this process, and some that will be able to continue on. So, Kate, let me turn it over to you for maybe any final comments you want to make.
Yeah, Brad, thank you. Really just join in the gratitude, and thanks to all of you. The way in which this is crystallizing is just so exciting to us. It's an amazing bellwether for a new way of being for DSS. So really appreciate it. I think we have exceptionally useful feedback on this report. Those 3 points that were made, the kind of state of where we're situated across the country with Medicaid programs, with data transparency and efforts, as much as we can capsule that. I think really great point. The bookending of the piece around the statement of intent with a kind of specific signaling of how we expect to be influenced by the data that we are profiling. And then Karen's point about the kind of specific nexus of this transparency work with emerging initiatives, CHESS, maternity bundle, value-based initiatives, and behavioral health, just to name a few. I think all those things are super well taken in terms of how we can augment the report. I also think we now have a clear frame for next stages of work for this group. I think Brad's very useful suggestion around the charter, kind of solidifying plans. Oh, excuse me, I beg your pardon. The fourth element for the report was more commitment of benchmarks or timeframes for the successive stages. So those are the 4 pieces I heard around augmenting the report, all of which were super helpful. Then the next stages of this group, the charter focus that Brad had proposed, kind of establishing intent and cadence of meetings, kind of future work stages. I think that the one remaining question that I have, I wonder if we could just take a few minutes to comment on, would it be the will of the group that we continue through the summer months, with that charter work? Would people prefer to have a little bit of an interval over the summer and maybe resume in September? I don't want to lose the momentum at all, but I want to certainly be respectful of the fact that I know we're all finally in the position to be able to actually take some well-deserved time off. So perhaps it would be great, Brad, could we just ask people if they could weigh in a little bit on that?
Sure. And maybe if folks that are present, we could even try and do a brief raised hand or something like that, just to get a sense of the members who are on. So if you would, if you'd prefer to, we'll start with, and I also know it's important which one I asked first in terms of like, do we wait until September or do we start now? So I'm trying to figure out in my mind which one makes the most sense to ask first. Let's start with raise your hand if you'd like to continue to meet throughout the summer. So for those who raise your hand, or I think Grace clapping, I see you, Susanna, raise your hand. Okay. Sandy and Jim. Okay. And Kelly, I see a thumbs up. So I'm seeing 8 folks. Okay. And then raise your hand if if we're going to put their hand down. And then anyone, those who would prefer to start meeting again in September, to basically take off July and August and reconvene then. And I guess your hand up. Ben and Grace, I think your hands were up from before.
Yeah, I'm trying to get it down. It's not going down when I'm telling you to.
That's okay. I got you covered.
Legacy.
So just
yes, we don't want to do approval voting here. We definitely want to have distinct votes.
Yes. Okay, so Meg and Colleen. So I think in favor of meeting over the summer. Maybe we can take a hybrid where we meet, we could even aim for either late July or early August, basically do one more meeting over the summer and then meet again September. So maybe not double up, do a happy medium. So we don't lose momentum, but also not giving people a little bit of breathing space at the end of this. Does that
I
sound
think that'll get determined by the scheduling. To get
exactly
get a meeting schedule, that would be
right. Natural constraints, right, Grace?
Yes, the natural constraints. We may all want to meet over the summer, but maybe the next meeting doesn't happen until September. I don't think that's the case. I think the goal should be we meet again in a month or 4 to 6 weeks, ideally, and I'll happy to send a note about that. And then also we'll need to identify if for everyone who does want to continue or does not want to continue. So that'll be the other piece, and I'll probably ask Jody for some help in identifying folks, just clarifying if people want to continue to be involved or not. Okay, so thank you, Kate. Let me pass it back over to you. See if there's anything else you want to add, or otherwise I think we're in a good place.
Yeah, no, I think we're great. And I just want to say how excited I am that everyone endorsed moving forward. Terrific news. That's just exactly what we hope to hear.
All right, well, with that, I think we can wrap up, give everyone a couple minutes back today. Thank you so much again. And I'll be sending out, I'll incorporate some of this feedback into this report, make sure Kate and Susan have time to weigh in on it, and then send out another draft to all of you by July 1st, and then ask for your feedback probably by the 6th. The 5th is probably by that Tuesday after the holiday, so that have time to make any final adjustments before we actually kind of formally approve it and get it signed off by the commissioner and start presenting it to everyone. So I'll be in touch basically, and I think by the end of this week. All right, thanks everybody. Have a lovely day.